Thanks for joining us today. I'm Cody Holyoke. We begin with a difficult conversation about something that is killing our kids, our friends, our family members. Despite a fight on many fronts, opioid overdoses aren't going away. In fact, the death toll is rising. Last year's numbers are still coming in, but in 2021, more than 80,000 people nationwide died from opioid overdoses brought on by drugs like heroin and fentanyl. Locally, opioid overdoses killed well more than 1,500 Missourians the same year. That's 1 out of 47 deaths that year, according to the state. And in Kansas, 428 people lost their lives to these drugs. Aside from intervention and prevention efforts, there's a special drug being used to bring people back from the brink. It's called naloxone, more commonly known by its brand name Narcan, and it can reverse an opioid overdose. But access to Narcan can be a challenge. All that's changing soon, though. The FDA just approved Narcan's nasal spray for over-the-counter use without a prescription. Health experts and local risk reduction advocates say that easy access, which should start this summer, is desperately needed in our community.
You never know when. You never know when someone might overdose, and we have to bring them back to life. So hopefully they can make a decision to get off the drug.
And there's a real impact for people and families in our area. Take Josie Willis Klein, for instance. She's seen her brother, her uncle, and her friends die from fentanyl poisoning. She says keeping Narcan on hand could mean keeping her people alive.
Just in case another scenario like that goes down, because I'm not trying to lose nobody else. I'm tired of losing people. People going down left and right, and it's like, where does it end?
Sadly, Josie's story is one we've heard a lot here at home as opioid deaths become more common. And the hope is that this new step, this new access, will help many families avoid a similar fate. But it is a complicated issue, so let's get to the heart of the matter. Please welcome Drs. Stephen Thornton and Rupa Sethi from the University of Kansas Health System. Thank you for coming in to you both. We showed the statistics a moment ago. Opioid overdoses, fentanyl overdoses are a major problem. No one disagrees about that. Dr. Thornton, we know that you're an emergency room physician. You've seen the toll that these overdoses can have firsthand. What does this news mean for our community?
So I think this is an important and necessary step. With this opioid epidemic, we've moved to a phase of harm reduction. We know it's happening. We're just trying to get on top of it and prevent people from dying. Narcan is the antidote for overdoses of fentanyl, heroin, any of these opioids. And the more that we have naloxone out in the community, the more lives are going to be saved. So I think it's a very important step. I think it's a necessary step, and one that I think ultimately is going to save lives.
Right. We talk about access, widely agreed by the healthcare community that this is a good thing, right? Critics have long claimed, though, and you're already smiling because you know what I'm going to say, that having more access to naloxone and Narcan could somehow promote further opioid use. Dr. Sethi, you're in charge of the health system's addiction clinic. Do you buy that? If people know that there's potentially a way out, does that factor into their drug use?
That is not correct. In fact, it's just like an EpiPen. If somebody has an allergy and they carry an EpiPen with them, and in fact, if they have that allergic reaction, they can use it. If you have a naloxone kit with you and you see somebody overdosed, or some of your family members sees you overdosed, they can use that, save your life. A lot of people who have come to our addiction treatment center have come after they've overdosed, and they've been saved by that naloxone, and they've gotten some insight and said, okay, I don't want to ever do this. I did not want to do this. I did not want to die. I want to seek treatment, and I want to get help.
Would you consider this, Dr. Thornton, a game changer? Because, I mean, the drug's been around for, 7, 8 years now, but the access has been a little difficult.
So we've been seeing this over the last decade or so, this increasing in the ability to get hold of naloxone. It went from basically being something that was really only used by EMS to now being dispensed by pharmacies to now being over the counter. And it's such a important part. Again, I think we all have to emphasize that it is part of the answer to this problem. It's not the whole answer, but it is a part that's going to keep these people alive so they can get the treatment that they need to deal with this devastating disease.
Right, before they get into your addiction center, they need to have survived this, I imagine.
Yes, survived this, absolutely.
What's the biggest misconception about Narcan that you've heard?
Just like you said, that maybe this will promote more drug use, but it's a game changer.
When we talk about the opioid epidemic, I mean, you've both seen this firsthand. Is it getting better or worse, in your opinion, here locally?
It's not getting better, but there is more and more access to treatment. We have the Addiction Treatment Center here at the University of Kansas Health System, and now that buprenorphine, which is one of all other medications that we use, is more readily prescribed by physicians because the data waiver that was taken away recently. So there's more access to care, which could be life-saving for a lot of our patients.
You're seeing that too in the ER, I imagine.
No, well, I'd have to say, definitely over the last 10 years, you've seen an explosion in the opioid problem here in the Kansas City area, for sure. We're seeing now probably daily folks coming and needing Narcan. They're found basically dead. They get Narcan, they brought back to life, basically brought in. We're seeing that very, very common, whereas before that was kind of once every now and then kind of thing. So it's all over the place. This fentanyl's everywhere. It is impacting not only the substance users, but also their families, the children. It's in the home. So it's a huge, not only problem for law enforcement, for the healthcare, but for public health. And really, when you're looking at addressing this issue, it's going to take input from all those areas.
Like you said, it's multifaceted. Do you recommend that families get some once this is available?
Yes, absolutely. And all family members should know how to use it. In fact, in our clinic, sometimes our patients will tell us that they have not used it on themselves, but on another family member, a child who mistakenly took an opioid or had access to an opioid and wanted to try it, an adolescent that did it, and it has been a life-saving drug for a lot of people.
And real quick, just to hammer this home, by itself, Narcan naloxone is a safe drug, right?
So I would go so far as to say it is now the safest over-the-counter drug we have. Safer than Tylenol, safer than Benadryl, safer than anything else that's out there. You literally cannot overdose on it. It's only going to help you. I've never seen anybody have an allergic reaction to it. So it is literally the safest over-the-counter medication, and at the same time can be life-saving. So I think that's a huge, you're looking at risk-benefit here. It's all benefit. There's no risk.
All right, Dr. Thornton, Dr. Sethi, thank you so much today for coming in. Again, over-the-counter doses will likely be available by late summer. For a list of resources and more information on the FDA's announcement, you can go to KMBC.com.